If you have diabetes and notice one foot feeling unusually warm, pay attention. This could be serious. Ignoring it could lead to complications. Imagine your dad thinking, "It doesn't really hurt, so it must be fine," but he might be missing a crucial warning sign. Let's talk about diabetic peripheral neuropathy. This condition damages the nerves in your feet. It can cause tingling, burning, or numbness. In some cases, you may feel very little. According to the American Diabetes Association, nearly half of neuropathy cases show no symptoms. But here's the issue. Your foot could be injured, and your brain isn't getting the signal. This is where Charcot foot comes in. It's a dangerous condition, often overlooked. Charcot neuroarthropathy causes one foot to become hot, swollen, and red, often with surprisingly little pain. Recognizing it early matters. If neuropathy is involved and a hot, swollen foot appears, it's crucial to seek medical attention right away. One way to check is by comparing both feet. Is one noticeably warmer? Their temperature matters. Next, consider swelling. Did one foot suddenly swell up without reason? Don't assume it's just from being on your feet too long. Is there redness, warmth, or an unexplained injury? Such signs warrant immediate evaluation. Now let's discuss redness. If one foot appears red, don't ignore it. Redness can indicate infection, inflammation, or Charcot changes. Always seek medical advice if you notice these symptoms. Pain is another factor. A person might have an injured foot but feel hardly any pain. This can be misleading. Nerve damage can diminish your ability to feel signals saying something is wrong. Parents often downplay their discomfort to not worry their family. But adult children need to be vigilant. Watch for changes, whether they complain or not. If Charcot changes go unnoticed, the implications can be severe. Continued use of an injured foot may lead to further damage and even deformities, which could cause ulcers or the need for surgery. Early recognition allows for better management and can prevent serious complications. Remember, not all hot, swollen feet indicate Charcot foot. Other causes could be infections, gout, or circulation issues. If you notice sudden swelling extending to the calf, it's crucial to seek medical care immediately. So, what should you do? If one foot becomes hot, red, and swollen, it's essential to act fast. Don't wait weeks. The ADA recommends urgent referrals for unexplained symptoms. Avoid weight-bearing activities on that foot until evaluated. Perform your daily foot checks. When you remove your shoes for the evening, look closely at both feet. Check if one is more swollen or red. Feel for temperature differences and look under your feet for unnoticed injuries. If you've had diabetes for a long time, I understand you may be tired of constant reminders. But this is vital for your independence. Protecting your feet means safeguarding your ability to live actively. If family members are watching, recognize signs of discomfort in your loved ones. Initiate a conversation to suggest seeing a doctor, not as an attack, but as a way to help. Remind your elderly parents proudly how much they mean to you. Sometimes, that's all it takes to encourage them. And if you're a grandchild, help keep your grandparents active and healthy. In summary, pay special attention to 1. One foot feeling decidedly hotter. 2. Any unexplained swelling. 3. Redness on any part of the foot. 4. Little to no pain despite visible injury. Ignoring these signs can be dangerous. When signs like these appear, seek immediate medical attention. Lastly, protect yourself and others. If you have diabetes, check your feet daily. Share this video with others who may be unaware of Charcot foot. Subscribe to Strong Past 70 for more preventive health tips. Look out for those warning signs, because some may not hurt at all. Thanks for watching. Take care of yourselves and your feet. See you next time. For health guidance, consult a healthcare provider. An unexplained hot, swollen, or red foot requires immediate evaluation. Please seek help for any concerning symptoms. If you notice your loved one frequently adjusting their shoes or grimacing when walking, Don't dismiss these as mere inconveniences. They could be subtle clues of discomfort signaling a deeper problem. Always approach such observations with care and compassion, creating a safe space for an open discussion about their foot health. Consider the impact of regular conversations about health. These discussions can emphasize the importance of monitoring foot conditions, making them a routine part of caregiving. Suggest starting each week with a simple foot check, asking your loved one to describe any sensations they feel in their feet. This practice fosters awareness and encourages their engagement in self-care routines, enabling better management of their diabetes and overall well-being. Sharing personal experiences or stories from others can also help reinforce the message that proactive health measures are essential. When initiating these conversations, be sensitive to their feelings. They might resist acknowledging discomfort or accepting help. Empathy is key. Take time to listen and reassure them that you genuinely care about their health and happiness. Encourage regular check-ins on their foot condition, highlighting that early intervention can prevent serious issues down the line. Consider introducing visual aids to assist in these conversations. A simple chart illustrating common foot conditions, including Charcot foot, can be invaluable. This visual representation helps demystify the symptoms they might experience and empowers them to recognize changes in their foot health. It's an opportunity to reinforce the idea that monitoring their feet is just as important as any other aspect of diabetes management. Engaging them with relatable content not only fosters understanding, but also opens the door to proactive discussions, allowing for a collaborative approach to maintaining their overall health. By prioritizing education alongside care, you actively contribute to a healthier, more informed lifestyle for your loved ones. It's essential to reinforce the importance of regular medical checkups, particularly for those living with diabetes. Remind your loved ones that their healthcare provider is a valuable ally in their journey towards maintaining foot health. Encourage them to express any concerns they may have during their appointments. Open communication can lead to better outcomes. Furthermore, highlight the significance of proper footwear and encourage them to invest in shoes that provide adequate support and cushioning. Healthy feet can significantly enhance their everyday experiences, allowing them to stay active and engaged with family and friends. Together, by being vigilant and proactive about foot health, they can enjoy a more fulfilling and independent lifestyle despite potential diabetes-related challenges. Recognizing changes in foot health can be pivotal. Perhaps suggest keeping a foot journal, documenting any variations in temperature, color, or sensation that arise. This small effort can assist healthcare providers in diagnosing issues swiftly and accurately. Encouraging your loved ones to note their experiences fosters accountability in their self-care and promotes open dialogue during medical appointments. Regularly reviewing this information creates a comprehensive picture of their foot health, empowering both patients and caregivers alike. Each detail matters when addressing diabetic complications. When it comes to footwear, having the right shoes is paramount for foot health management, especially for those with diabetes. Warn your loved ones about choosing styles that might look trendy, but lack the necessary support. Shoes should fit well, being neither too tight nor too loose to prevent blisters and other injuries. Recommend visiting a specialist for foot assessments, as custom orthotics can provide added support, enhancing comfort and mobility. Encourage them to consider their shoes an investment in their well-being, ensuring they can remain active and engaged in their daily lives, creating cherished memories with family and friends without the worry of foot complications. Encouraging regular foot checks is essential, particularly for those with diabetes. Stress the value of routine self-examination, ensuring they look for common signs such as blisters or unusual redness. Reinforce that a simple habit of checking their feet regularly can prevent complications from arising later. By fostering this proactive approach, caregivers and loved ones contribute significantly to better management of diabetic foot health. It's a small but vital step in ensuring comfort and independence in their daily lives. Building this routine together creates lasting positive changes, making healthcare collaborative and supportive. In addition, reinforcing knowledge about appropriate footwear should be continuously discussed. ensuring they prioritize comfort while maintaining style. Another critical aspect to highlight is the role of proper nutrition in managing diabetes and, subsequently, foot health. Encourage your loved ones to maintain a balanced diet, focusing on whole foods rich in vitamins and minerals. Nutrition can aid in circulation and nerve health, both vital for preventing complications. Suggest incorporating foods high in antioxidants and omega-3 fatty acids, as these can support nerve function and reduce inflammation. Additionally, emphasizing hydration can promote overall health, ensuring their body functions optimally. Consider discussing meal planning together, making it a fun, collaborative activity that reinforces their commitment to a healthier lifestyle. By prioritizing nutrition alongside regular foot checks, you effectively safeguard their overall well-being. Encourage them to take note of how their feet feel after different activities. If they notice unusual sensations following a walk or standing for long periods, it's important to bring this up during their next health visit. This awareness can help healthcare providers tailor advice and treatment plans more effectively. Emphasizing a proactive approach allows them to take charge of their health, ultimately fostering confidence and a stronger connection to their foot care routine. Taking these precautions isn't just about preventing foot complications. It's about empowering loved ones to lead vibrant, active lives. Emphasize that monitoring foot health reflects a deeper care for their overall well-being. Let them know every small effort can make a significant difference in their diabetes journey.